Have you suffered a whiplash injury and are having symptoms of neck pain, headaches, or dizziness? Today's video is going to show you an example of a program that I would do with my clients who suffered head injury, whiplash, or neck pain from an acute to a progressed exercise plan. This is an appropriate sample home exercise program for someone who has been diagnosed with whiplash or just has general neck pain. If your symptoms do get worse or you're finding that you're having tingling or numbness or worsening symptoms, please stop and double check with your medical provider as to if this program is appropriate for you or if you need a more customized individual program. With that being said, whiplash is normally treated through a combination of range of motion exercises, stretching, isometric strengthening, progressive strengthening exercises and control, and then finally spinal mobilizations and possibly manual therapy or deep tissue massage type therapy. We're going to get started with an acute whiplash program. So that first few days to week of just starting to get general motion back into your neck. Okay, so when it comes to treating whiplash, I want you to start by first getting normal, proper range of motion. So the first thing we're going to start is pain-free, 6 different ways you are going to be moving the head. So go at a pace that doesn't make you uncomfortable or dizzy. You're going to shoot for 10 just to improve that blood flow that's going into the muscles and maintaining proper mobility of the spinal bones or segments themselves. So again, stop if any of this makes you uncomfortable, increases a sharp stabbing pain, or numbness into the arms. If all you can do is a 45-degree turn, kind of respect that and come back to the center. You're going to try 10 rotations to the left, trying to increase as you increase your number of movements. Then we'll do 10 to the right. Again, just respect what your neck can give, only moving as far as you feel comfortable. After rotation, we're going to try side bend. So take your right ear to your right shoulder. Again, going for 10 of anything. Completely normal to feel a pull on the opposite side and maybe a slight pinch on the same side. After 10, go ahead and slowly repeat that to the left side. Now I want you to do range of motion exercises. For probably that first week, you're just improving that contractility and the flexibility of the muscles on the opposite side and the contraction on that same side. Trying to get that inflammation out of the neck. Go ahead and follow with chin tucks for me, trying to get better motion backwards. A lot of us are forward anyways throughout our day, so just do what feels comfortable. As you'll note, I'm not looking down, I'm not kicking my leg or my head back. I'm just pretending my chin is on a shelf and sliding, almost giving myself a double chin. So 10 that direction. And then I'll have you do up and down. If you get dizzy, just don't go as far. So up and down to your ability. So after you do 10 of those, you're gonna follow that with stretching. So sometimes the muscles need a little bit of an extra hand. So I want you to start with an upper trap stretch, sit on your right hand, take your left, grab the side of your head and gently pull. Now from here, what I want you to do is not lift your head up and down. I just want you to breathe in and then exhale and try to sink into that stretch. I want you to do 3 to 5 of these. If it makes you uncomfortable at all, just do less reps. Eventually working into 3 or 5. So there's your upper trap stretch. Now you can take a break. Sometimes with me, it's a little hard to move my head back, so I just use my hand to help kind of assist my head back to normal position. You'll do that on both sides. So you would just switch hands and give that gentle pull. You'll feel that stretch on your opposite side that you're pulling towards. And again, once you get to end range, you're gonna breathe in and then breathe out. So that just helps you kind of get a contract. So I'm contracting a little and then I'm relaxing into that stretch. So there's your upper trap stretch. Again, if you get any tingling, please stop. That's not an appropriate exercise for you. So let's go on to a levator stretch, which is this muscle that attaches to the base of the neck into the shoulder blade, the top of the scapula. So if you kind of are like this and you feel achy at the top of that shoulder blade, this stretch might be really good. So sit on that right hand again, turn your head 45 degrees, look down at your left armpit, take your hand and pull down. Now you're going to do your breathing in and out. And do 3 to 5 reps here. Okay. After that, you can repeat to the opposite side. Last stretch I really like is the SCM stretch. A couple different ways that we can do this, because I do like, especially with whiplash, because you get that back extension and forward, this through the front of the neck oftentimes doesn't get any love and is very tight for being overextended. So I like to hold my collarbone. This will get the platysma muscle and the SCM. So take one hand, put it on your collarbone, take the other hand, give a little extra support. You're gonna tip the head sideways, and then I want you to look up and almost jutting that chin forward. And I really want you to feel that elongation pulling down towards your chest and collarbone. And from here, as far as I can go, I'm going to breathe in and I'm going to breathe out. Now you should feel that more through the front of the neck, behind the ear, into the collarbone. If you don't, it might be because you're not turning that head a little bit. So pull down, tip sideways, turn up, and that will change the entire orientation of the muscle that you had previously stretched, and you'll get this more front of the neck and the scalenes. So these little muscles right here, they can get really tight and entrap nerves called the brachial plexus that go down into the arms and cause tingling and numbness. So by getting that compression on the collarbone, you can really stretch the front of the neck muscles, and it should feel great. All right, so next, now I want you to strengthen and stabilize that neck. So we are going to start with the easiest, isometrics. So for isometrics, we are going to put our hand up, and basically this is a wall. We are not going to move our hand. It is supplying force, and our head is going to push against that force. So what we'll do is a side bend first. You'll see this muscle contract. It's very light. You do not have to be aggressive and shaking with this. It's just a very light contraction of the muscle. It helps push out lactic acid, that chemical response that happens after whiplash that's saying something's wrong, I'm gonna throw inflammation into the neck. These exercises, the isometrics, can help stabilize and push that inflammation out. So let's take our right hand up towards our temple, and I want you to pretend that you're tipping sideways, but the hand is going to stop. So you're going to push lightly for 5 seconds, 1, 2, 3, 4, 5, and then relax. And you'll note that contraction of my neck the next time. So I tip, 1, 2, 3, 4, 5, and then relax. Now, if your arm is tired, just give yourself a break, wait for it to rest, and then go back to trying to complete 5 reps. So tipping sideways to the right times 5 seconds and 5 reps. Repeat that to the left. Next, we're going to do rotation. So now I'm pretending I'm looking over my right shoulder, but my hand's going to stop. So I turn my eyes to the right, I get a little turn to the head to the right, 5 seconds, and relax. Again, 5 reps, and then we'll repeat that to the left side as well. After that, we are going to do extension. So I'm pretending that I am looking up, but my hand is going to stop. You could also put your head up against a pillow, against the wall, and also do this. So put your hand up, 1 or 2, doesn't matter, and I want you to just push back lightly into your hands. 1, 2, 3, 4, 5, and relax. Go ahead and push back again. 1, 2, 3, 4, 5, and relax. Last one would be forward. So you'll put your hands right here on your forehead and just gently pretend that you're looking down towards your feet for 5, and then relax. I'll do that with one hand so you can see my muscles contract a little bit better. So I'm flexing down. As you can see, there's a contraction, and then relax. Again, these muscles with whiplash do get quite the damage because of the coup contre coup, or extension and forward flexion that you get with whiplash. Next, we're going to progress into postural strengthening. Why we're doing this is to build endurance, to push blood flow up into those muscles, push the lactic acid and inflammation out. So postural strengthening is going to be combined with a progression of those isometrics. You're going to need an exercise ball or a table, foot of the bed, side of the bed, where you can lie down and do these exercises that will help stabilize and control our neck. So here on the bed, the most important thing is that you have good form. So when you are hanging over the edge of the bed, you don't want your head down, you don't want it flexed up, you want it in line with your spine. You can use one hand if you like. You're gonna give yourself a double chin. This is probably the hardest one you'll do. You remove your hand and hold that double chin for up to 30 seconds. That would be normal. A lot of people start shaking or their head comes up. You stop immediately and you give yourself a break. So I don't care if you do 5-second holds times 6. I don't care if you do 3-second or 10-second holds times 3, or 1 30-second hold if you have the endurance to do so. It's very challenging, so take breaks as you need. So 30 seconds in this position, roll onto your side. Again, you are not having your head up, you're having your head neutral, not down. So keeping our head in line, give yourself a double chin and hold there for 30 seconds. You're going to do that on both sides. This tends to be a little easier than that first position. Just have a friend tell you if you are in alignment if you cannot tell. Last is on your belly. Look over the edge of the table, give yourself that double chin, and you're going to hold 30 seconds in this position. So this is a nice strengthening routine for those postural muscles that are meant to keep us more upright. So if you've suffered any injury, having neck pain or whiplash, these exercises are going to be important for you to avoid that slouching posture, to improve blood circulation and push out lactic acid that could be stuck in those muscles from your injury. So with these exercises, I want you to pick a weight or a resistance that kind of gives you a burn on the last 2 or 3 reps. We should not be shaking and straining during these exercises. It should be moderately comfortable without strain. We're going to start with rows first. Next, I'm going to pick a lighter weight. We can stand up tall, hands up towards the ceiling, and you're going to pull that band apart from one another. This gets your rotator cuff, the muscles, your external rotators that kind of keep our shoulder blades, again, going backwards. For me, 10 reps is going to be enough at this weight, and then I start to feel a little burn, so I will be done. Now with all of these exercises, if you haven't noticed, the main goal is to retract or pull our shoulder blades back. So with each exercise, make sure that is the intention. That squeeze in between the shoulder blades at the end of your movement is what you're going for. So make sure that you do have a full movement with each of those reps and exercise. I will link some affiliate links to the items that I like to help with dealing with whiplash, including the TheraBands. I really love Arnica cream. Arnica is a natural anti-inflammatory, which you can get on Amazon. It's a really great topical that you can use to decrease soreness. Also, a Theracane can be super helpful in dealing with those muscle knots that you may have in between manual therapy sessions. So I'll make sure I put that in the descriptions below of some of the tools that I like to use when dealing with whiplash as well. If you have any questions, leave them in the comments below. Until I see you next week, stay healthy, stay steady, and stay strong.